mind when it comes to healthcare because, as you said last week, our idea of what healthcare is really isn't the ideal healthcare.
No, and actually what we have is not a healthcare system. We have a medical model for delivering services, healthcare services. And so you have several different ideas on what you would actually do to deliver health to these people, but for the most part, what we base our health on is symptoms and how we feel. And so we're giving that responsibility away to three different groups. The first group is who we go to when we're sick, right? Mm-hmm. Yeah, so we go to the medical doctor. He tells us what's wrong with us, hopefully, what we need to take. Hopefully there's an option for that, and then how long we need to take it for. And then who tells him what to do with that?
Who tells the doctor? Who tells me?
Who tells the doctor?
Well, I'm guessing wherever he went to school.
Yeah, well, it's actually the insurance company more than anything else.
Well,
like they're the boss. They're the one that control the finances.
True,
they'll tell them which services are covered under your insurance plan. Mm-hmm. And then when the money runs out, he's either done or you have to pay out of pocket for it. And then the last group is actually the group that incentivizes healthcare in our country, and that, for the most part, is pharmaceutical companies. Right now. So they're doing most of the research. They are paying the doctors, not as blatantly as they used to because there are now some laws in place to keep that, but they'll give them free lunch. They'll come in and regularly. They'll put them on their board of trustees to advise them on certain conditions if they prescribe their medications. Mm. And so that right there is what we consider our healthcare system, but it's really just the medical model of health, and it's not working out very well for us, is it?
Well, it almost sounds like the medical model is not surrounding itself around medicine, but around the dollar.
Yeah, it really is. And really, in a capitalistic society, when you have things like healthcare that are based off of income, what you can make off of it, then you're answering not to the patients that you're taking care of, you're answering to the actual shareholders of each company. And so that's why places like Pfizer, they've gotten indicted on numerous counts for kind of manipulating the data of their studies and holding things back from the FDA. I'm not saying they do this all the time, but there are court cases out there with examples of researchers going to jail because they manipulated their numbers to get their drug approved by the FDA. And it's not good. And I'm not sitting here advocating for a socialist system at all. What I'm advocating for is that instead of handing the responsibility for our health to a medical doctor or any physician at all, including myself, I would say take that responsibility back and know what health is. Because right now, the system that we have is not setting itself up for success because we're handing that responsibility away. You look at the World Health Organization, right? So they do a study every single year, and back in 2000, it was the first and last time that they actually ranked the healthcare systems of the world. They took all 208 or however many countries there are, and they kind of put them in order of things going in and things coming out and how well that was working. The United States, when you compared them to the industrialized nations, they ranked dead last.
Wow.
Yeah, 37th out of 37 industrialized countries, tied with the country known as Slovenia. And if any of our listeners know where that is, call my office, 531-289-7100. I'll tell you, good job. Yeah, we're giving medical financial aid to some of these countries, sending our doctors to Doctors Without Borders and helping countries that have a better understanding of what health is and where it's coming from than we do. I mean, we spend, some estimates are up to $10,000 per person per year on health care costs. That's not premiums, that's deductibles, that's coinsurance, that's copays, all these things that you have to pay in order to get medical services. On average, $10,000 per person per year. You look at the amount of medication that we take, because when you go to the doctor, they tell you you need to take something, or even non-prescription stuff. We take 74% of the world's prescription medication, 80% of the world's painkillers, and 90% of the world's antipsychotropic medication. And so you would hope that those things would lead themselves, if we're number one in those categories, would lead them to a good outcome as far as health is concerned.
Well, yeah, you think, okay, if we have all these drugs, then we must be number one then. We must be doing a good job, but we're dead last in industrial.
Yeah, we're dead last in industrial, and as far as life expectancy is concerned, 92nd overall if you include all the countries. So when you compare us to places like Nigeria and Slovenia and Slovakia and all these places that you might not even want to visit because of how poor it is, some of them are doing better than us. And key measurements like mortality rate, infant mortality rate, Costa Rica is doing better than us.
Wow.
Yeah, it's not good.
Unbelievable.
And so we have to do something about it. And some people will say, well, it's because we don't have access to medical services. That's just dead wrong. We actually have such a great access to our medical services that if you're a homeless person living under I-80 right now and you twist your ankle and hobble into the emergency room, they have to treat you by law. They can't turn you away. And so the Affordable Care Act, they've actually done a lot of really good things in making things like health insurance approachable to everyone, but health insurance isn't solving anything because you still have that deductible, you still have that coinsurance, you still have that the premium that you have to pay in order to get those services. And in a lot of regards, that's actually, when we rely on our health insurance, we give that responsibility away again. We're just not getting the health that we're looking for, and we're also being very reactive. Right? So let's go back to the car analogy. We talk about cars a lot in here because it's something that we all have to take care of on a daily basis. Or not daily, but regular basis.
Yeah, on a regular basis,
We're putting gas in it. You can say gas is very equivalent to food, right? Food and water. You have to eat that. You have
That's
to drink
your
it.
energy source.
Your energy source.
Sure.
You talk about things like maintaining the car, oil changes. You've got your check engine lights. You've got things like balancing the wheels, changing the tires. Yeah, all the tune-ups that we have to do. And people in the medical model will say, well, that's going to your doctor and just having him look at the dashboard, check all the lights. Well, what happens when you have a check engine light on? Well, that gets annoying after time, right? That little red light just staying there. First it blinks a couple times, then it stays there, and then it's like, oh man, that's just annoying. I got to take care of that, but the car's still running, right? Hopefully. Yeah, if the car's still running, we just kind of drive it because we're busy people. We have busy lives. We have things to do. We value other things more importantly than keeping that car going. But eventually it's just like, hey, we got to do something about this. So say we were to take that car and we were to drive it into any, car repair shop and say, hey, this check engine light is bothering me, do something about it for me. And he comes out with a thing of electrical tape and just covers that up and says, good to go. What are you going to do to that mechanic immediately?
I'm going to say, well, I'm going to go, no, you didn't fix the problem.
Yes, exactly. He didn't fix the cause of the problem. He may have covered up what was the problem to us because the car seems to be running fine. All these things, we're not feeling any symptoms. The car's not rattling, there's no smoke coming out of the engine. But there's a problem underlying, isn't there? And so he's got to check the computer to make sure what it is, go find out where those sensors are off, that things are misfiring. Is it a problem with the sensor, or is it a problem underneath that the sensor is built to detect? And that's where we have to look, is actually at the cause. And current medical model says, now let's actually look at the symptom, let's cover that up, because that ibuprofen, that Tylenol, it's actually just covering up the symptom. Pain is not the health problem. It's what that pain is a signal to your body to tell you that something is going wrong.
So it's like if I cut my finger, pain isn't the problem. The problem is my finger's
Yeah, exactly. If you've got a sore tooth, the problem isn't that your tooth hurts, it's that it's rotting underneath, and a dentist is going to go in there and he's going to do his best to fix that. In a lot of ways, our acute care system, which is the best in the world, you have a better survival rate for things like a heart attack or getting hit by a car than anywhere else in the world. If you go in there, they will go in and they will remove that knife that's stabbing and cutting a vital organ or artery and sew that back together. That's where our medical model is doing well, is in that. But we're not dying of those things. 2/3 of deaths in the United States right now are coming from lifestyle preventable diseases. And we'll talk about that more after the break.
You got to take that break, and we are talking about that first pillar of Maximize Living Healthcare, Maximize Mind. And a part of that is, what is health? We're diving into that question today. We'll have more on the way right after this on KFOR. Woo-woo.
Ooh, 1 segment down.
Yeah, we'll run through it. Phone keeps...
Getting messages from home?
Yeah, my wife.
Okay.
She must be on her lunch, so I told her, I have a recording at noon.
Yeah, we can't have our normal noontime phone conversation.
Yeah.
Yeah.
Well, some days there is, some days there isn't. Kind of depends. So
Depends on the schedule.
yeah, exactly, and that's the thing. Sometimes I'm a little swamped. Sometimes she's a little swamped.
Yeah.
You never know.
Yeah, Kirsten and I do the same thing. We'll typically chat about the same time, and we got in a little rhythm, and then I started doing team trainings with my staff.
Sure.
About that time, and so she'd send me a message, and it'd be crickets for 2 hours.
Hey, I haven't heard from you.
I'm like,
You
oh,
okay?
starting shift now. Sorry, I missed you. We were training. She's like, oh, okay. Guess I'll talk to you at supper.
There you go.
Yeah.
All right. So how do you want to? What do you want to hit on this segment?
Yeah, so I want to switch into kind of the main causes of death in the United States, being heart disease, cancer, diabetes, lifestyle preventable diseases for the most part, as far as what research is considered. I've got a great study in here on cancer. Actually, this one says 60 to 70% preventable just by making lifestyle changes. I've heard as much as 95%. But then talking about the things that we typically will use. So I'm going to talk about how, if you just base your health on how you feel, it's not setting yourself up for success. But if you actually look at how your body is functioning and healing.
I was going to say, do you use the term function?
Yes.
Okay.
Yeah, I use function a lot.
All right. Because I was going to mention
Yeah.
that. So I didn't want to like sub looks at
Yeah, no,
people don't know what that is, but
no, we can take 20 minutes and explain that.
yeah, right. All right.
Yeah.
Back on the show, Maximize Living Radio with Dr. Jake Tucker from Maximize Living Chiropractic, Good Life Family Chiropractic here in Lincoln at 56 and Pine Lake Road. No, Yankee Hill Road, isn't it?
No, Pine Lake.
Pine Lake Road.
Yeah.
I always mix my two streets up down there
Yes.
because things are growing so fast. 56 and Pine Lake Road, you can find them down there. And we encourage you to stop by, get more information, or even call the office.
Yes, right now we've actually got 5 spots set aside. The first 5 callers will win a discounted exam and x-rays. Normal fee for that is $130. If you call and tell them that you heard us on the radio, 531-289-7100, and you're the first 5 callers, we'll do that exam and any necessary x-rays for just $52.
That's a great deal. And there's a lot to it, and one of these shows coming up here, we'll kind of dive into that. We don't have a lot of time today because we're talking about the question, what is health? And the first segment really hit on what's going on in the world today when it comes to health care, where the United States ranks when it comes to industrialized nations, i.e. dead last. So let's talk a little bit more about what is health.
Yeah, and absolutely. When I ask somebody what is health, most people will tell me
How I feel. I
how
feel good.
Exactly. I feel good. I must be healthy. Or the opposite. I feel not so good.
Yeah.
I've got a headache. I've got neck pain. I've got back pain. My stomach's bothering me, and they'll say that I must be sick because I'm feeling bad. Well, that's actually an awful way to base your health. I mean, it's the one signal that we can rely on. But if you look at things that take more lives than any other in the United States, the number 1 and number 2 cause of death in the United States right now are heart disease and cancer. If you wait until you feel the first symptoms of heart disease, on average you're waiting 20 years before you feel that. You could have high blood pressure, may not feel it. You could have high cholesterol, may not feel it. You could go on down the line, all these things that even doctors look for may not even show up until 20 years in, and you've had heart disease, but for 60% of people, that very first symptom of heart disease is actually the heart attack itself. And even though we have a better survival rate for heart attacks in the United States right now than any other country in the world, it's still only about 40%.
It's funny that you say that because from my personal experience, I had a family member pass away middle of the night, perfectly healthy, worked out, ate right. It was healthy.
Yeah, you could if you were just looking from the outside, and he probably said he was healthy because of all these things that he was doing. I mean, when we ask people not to base their health on how they feel, and you go into one of these natural food stores that we've got a great variety of those here in Lincoln, and you ask the shoppers, what do you need to do to be healthy? They tell you, well, I need to eat right, I need to exercise. But we all know somebody that ate right and exercised and still had a heart attack, got cancer, died too young. I mean, Bob Harper, he was just in the news. He's the Biggest Loser. He's their fitness guru.
Yeah, their fitness guru guy.
Yeah, he also wrote a book on nutrition here recently, 2 weeks ago. And they asked him, well, why'd you have a heart attack? He said, well, my dad had heart disease. My mom had heart disease.
So it's genetic.
He based it on his genetics. But when we look at actually some of the research that comes out on these things, the Columbia School of Public Health says that up to 95% of things like heart disease, cancer, diabetes are preventable just by simple lifestyle changes. diet and exercise. And he was doing those at the best. So we need to kind of take a look beyond just nutrition and exercise, because everybody's got an Uncle Gary, right? Mm-hmm. You know, he smokes, he drinks. Yeah, he's hasn't met a vegetable that he likes unless it's battered and deep fried. And
he's 104.
104, yeah, or he's going to get there
Yeah,
and
exactly.
probably not be sick a day in his life. And the difference lies in essential number 2. It's the nervous system. The nervous system controls all function in your body. For your heart to beat, for your lungs to breathe, for a cut on your leg to heal, information has to flow from the brain, down the spinal cord, and out the nerves to every organ, cell, and tissue in your body. And the kicker of that is it also has to go back. It's a back and forth communication. And if either side of that pathway, that feedback loop, is disrupted, that is going to start to disrupt the health of those organs. Your heart, your lungs, every organ in your body, they regenerate brand new 5 to 10 years on average. Brand new heart.
Wow.
Yeah, your heart right now is different than the heart that you had 5 to 10 years ago.
Did not know that.
Yeah, that's incredible.
That's amazing,
Yeah,
actually.
it's an amazing, incredible healing power inside of our brain that controls that function. But if that's disrupted at all, and research shows us, there was a University of Colorado research study where they actually measured signals being disrupted in the nervous system. They found that the weight of a dime, 5 millimeters of mercury, was enough to disrupt that signal by up to 40% coming off of the nerve roots. And so that's surrounded and protected by a pretty incredible
Wow.
system, because when God created our bodies, he was not dumb about it. This system is important. It's also susceptible to pressure and damage. That's surrounded by the hardest material that we have in our body, which is bone.
Mm-hmm.
And so our spine, our skull, surrounds and protects the brainstem, the spinal cord, and then each of the nerve roots as they exit off. Any of those parts that are susceptible to that weight of a dime, they are completely surrounded and protected by that bone. But that bone has a normal position. And we talked about this a little bit last week with how truck drivers can take their spine out of position just by sitting down, how we take our spines out of position just by looking down at our cell phone. And then if you do that, or you look at a computer screen for hours a day at work, over time our spine leaves that normal position. That normal position is straight up and down from the front, 345-degree curves from the side. When it's in that position, 100% protected. When it's out of that position, that's where we start to see tension, pressure. I measure that on x-ray with just 2 millimeters off. Most even medical doctors, they're looking for cancer, they're looking for fractures, they're looking for gross misalignments. 2 millimeters, 2 degrees away from normal, and I'm starting to see that weight of a dime. Now you can say, oh, that's really kind of over the top, isn't it, Dr. Jake? Well, most people aren't coming in with 2 millimeters off. They're coming in with 10, 20, 30. I saw a lady in a wheelchair had 80 millimeters of forward head posture. 80 millimeters. Can you imagine the tension that puts on your brainstem? Because when you think about your skull, it's a bowling ball, 10 to 15 pounds, depending on how smart you are, right?
Yeah, right.
Yeah. Now, if you go down to the bowling alley and you're bowling, how long do you think you can bowl if you just stick your arms straight out with that bowling ball in your hand and walk around with that? Yeah, just holding it there.
The dead man's weight.
Yeah, the dead man's weight all the way out, completely extended on your hands, arms straight out at a 90-degree angle. Not going to go very long.
No.
Well, having forward head posture is the exact same thing. It's much lighter to carry it close to our bodies. In fact, directly ear over shoulder is the easy way to measure it. The more accurate way, we get into really technical details on x-ray, but it's the anterior pituitary gland. It should be lined up with the C4 vertebra. At 0, your head weighs what it weighs. But every inch that goes forward adds 10 pounds of pressure, and where we see that hitting is at the fulcrums. We'll develop degenerative arthritis at the front of our neck, the vertebra C4, C5, C6. Those are the ones that we most commonly see degenerative arthritis. And that's simply gravity and Wolff's Law. Gravity and Wolff's Law. And I can get into really, really nitpicky, but basically just say gravity is undefeated. If you try to beat it on your own, you're going to lose. But we'll get into a little bit more of that after the break, all right?
Well, and of course, we want to remind people, too, of the 5 spots that are open during the show right now that you've opened up specifically for people to call in.
Yes, call now. It's 531-289-7100, and tell them that you heard about us on the Maximize Living radio show on KFOR 103.3 FM.
And you get that $130 down to $52 for the exam. That includes, And like you went into some detail there. That was, I think, tip of the iceberg.
Yeah, very tip of the iceberg. We have a 4-point neurological assessment, and we can do a whole show on that assessment. But then we take X-rays, and the X-rays are not your typical X-rays. They may look like typical views, but I'm going into really in-depth look at what kind of physical, biological stresses you're putting on your nervous system.
And that's that new area code here in Lincoln, 531-289-7100. We'll take a break. A few minutes left right after this.
All right. How much time do we have left?
4 minutes.
4 minutes. All right. We're going to have to wrap this up fast.
Oh, yeah. Okay.
Yeah. All right.
All right. The key point you really want to hit is 4 minutes.
I'm trying to think, because normally where I take this from here is like, well, why wouldn't your medical doctor be trained in this? You know, why is this different?
What I'll do then
Yeah.
is say, so you're not the only one using X-rays. Why wouldn't my medical doctor notice this?
Yeah. Yeah.
So
Okay.
I'll allow you to answer the question.
Yeah, I think that's good. I'll easily cover 4 minutes with that.
You're not trained to. That's not,
Yeah. Yeah, just no training. Okay.
They don't know.
Yeah.
It's not what they're taught. There we go. Final segment of today's show, Maximize Living Radio with Dr. Jake Tucker, Maximize Living Chiropractic, Good Life Family Chiropractic. Again, that number, 531-289-7100, to take advantage of that special that he has available right now for you to call in and get one of those 5 spots. And you're talking a lot about the X-rays and what you're looking at. The weight of a dime can really affect the nervous system. Why doesn't my medical doctor see this if I'm going to see him or her?
Yeah, well, for the most part, they're not taking X-rays unless you've had a gross trauma, right? Or they just can't find anything wrong with an organ system, so then they're going to take an X-ray and look like, really, is there cancer growing on your spine? Is there a fracture? Is there a gross misalignment? Is there something that somebody else missed? And they're trained to look for these, very serious diseases, but they're not looking necessarily at what the cause of those diseases are. But they are trained in this in some regard. And I'm going to throw this out there because they do know about pressure and damage to the nerves and what that can disrupt, because we learned about this in first quarter of med school. This is, that pressure can disrupt it, but they look at it in its disease form. It's called scoliosis. Scoliosis is any deviation of the spine where it should be straight up and down from the front off to one side or the other of 10 degrees or more. And so, if you have that 10 degrees or more, then what the research from Clear Institute for Scoliosis Correction is saying is that it actually decreases your life expectancy by up to 20 years. So if you've got a 50-degree curve, if you're just walking in there one shoulder down, you're probably in some pain. It's starting to squash your internal organs with that curve, but more importantly, it's disrupting the signal that's going out to those organs. Those organs are going to start failing at a much higher rate, so they're going to schedule an emergency surgery, put some Harrington rods in your spine, surgical steel, traction you out, try to minimize that scoliosis so that's not affecting you anymore. That actually enhances and promotes the quality and longevity of your life by putting those rods in there, whereas somebody that doesn't have a scoliosis, that would be a very detrimental thing. So you take that down to 25 degrees, they're no longer going to do the surgery for you, but what they'll do is they'll put you in a brace. And the brace has developed a lot over the last several decades. We've seen some really incredible improvements in brace technology, but that brace, unfortunately, it weakens the muscles of the spine. And so often what happens is when you take that brace off, your spine starts to collapse even more.
Because they don't have to work as hard.
Yeah, because the muscles that support the spine aren't working as hard. And so you take that down to a 9-degree curve, though. 9 degrees is no longer a scoliosis. Your medical doctor can measure that 9-degree curve, but it's not diagnosable. There's no ICD-10 code that I can put down on there as saying, that's a scoliosis or that's something bad. The most that you can put down is that's a segmental dysfunction, and there's a lot of segmental dysfunctions in there because a scoliosis doesn't function the exact same way as a normal straight up and down spine with 345-degree curves from the side. And so we want to make sure that we take a close look to see, is that going to develop? Because like I said, gravity is undefeated. Gravity and time, over time, will take a crooked spine and they'll make it worse. They'll take a crooked spine, it changes the biomechanics of just the way that the joint functions. It'll start to degenerate that joint. I've got a piece of research right here that they started mobilizing patients that were getting joint replacement surgeries back in the 80s, because what they found is that a joint that is misaligned or not working the proper way will start to degenerate within 2 weeks of
Wow.
fixation. And so if you've got a misalignment of your spine, of even just a little bit, that'll start to create arthritis in your spine within 2 weeks. And so it's very important that you get your nervous system, get your spine evaluated for that type of thing. If you want to avoid something as common as arthritis, most people blame it on age. Yes, it's age, but more importantly, it's not your age, it's not your genes, it's that misalignment, the time, gravity working on your spine. So you definitely want to take advantage of those first 5 spots. I'm sure most of them are gone by now, but go ahead and give us a call at 531-289-7100. Tell them you heard about Maximize Living on the radio. You want to do the 4-point neurological evaluation and see if you're a candidate for x-rays and then the type of corrective care that we do in our office.
It's good to have that evaluation because what if?
Yeah, what if?
There's a lot of big questions that can come from that what if. So 531-289-7100. Again, a half hour flies by, Doctor. Appreciate you coming in. We'll do it again next week.
And it sounds like fun.
Until then, have a great weekend, everybody. Woo!